Hello ladies, Dr. Shu here once again. So today we're going to be talking about our cervix and our sexuality. That much promised, much awaited video is here. So what do I mean by our sexuality and our cervix? What is our cervix? What is our sexuality? What has one got to do with the other? I'm going to be using this table of contents. We talk about human sexuality in general, our cervix, HPV. What's HPV? Human papillomavirus. What does it have to do with the cervix, the anus, the mouth? And then what are the complications of prevention of this particular entity we're talking about? So let's talk about human sexuality. What do I mean by human sexuality? I'm talking about the coming together of a male and a female, right? And when I talk about male and female, I'm not talking about gender identity. I am talking about sexual reproductive organs. So for human beings, it comes in two forms. It either comes with a sperm donor, which we call male, or it comes with somebody who receives the sperm, has eggs and sperm meet together within that person and develop into the human being, the embryo, the baby, and that person will call a female. So for the purpose of this talk, we have male and female. Right, so when we talk about human sexuality, what do I mean? I mean the coming together of the male and the female external genitalia to begin that thing called procreation, that thing called forming the baby. Right, okay. So, and these things when they come together, we call that sexual intercourse or acts of coitus. Right, good. I hope I'm clear. Now, when we're going to talk about the female external genitalia, I'm going to use some coded language because, children may be listening and I don't want this to become X-rated. So for the female genital tract from which the baby comes through, we're going to call that the V. And from the male external genitalia from which the sperm comes out, we're going to call that the P. So we're talking about the combination of the P and the V, right? And so that is what we call penetrative sexual intercourse, the coming together of the P and the V, right? And so now I have some questions for you. Do you know how many acts of sexual intercourse, of coitus, takes place per day worldwide? That's a teaser question for you. And I will give you the answer right away. It's been shown from studies that there are 100 million acts of sexual intercourse, penetrative, per day worldwide. 100 million. Wow, that's surprising, isn't it? Okay. And then let's look at other things. The number of new curable sexually transmitted infections per day worldwide. People have gone out of their way to study these things, So what I'm giving you actually results of studies, facts, not fiction, right? So now it's been found out that out of these 100 million acts of sexual intercourse per day worldwide, we have 1 million new sexually transmitted infections per day worldwide. So whether the person goes to the hospital or not, in fact, these are really from people who have presented themselves for care. So there will still be many others who don't present themselves for care, And so this figure is talking about those who presented themselves for care. 1 million new ones per day. So we can say almost 1 in 25 people have a new STI per day, which is curable. Now, whether the people go for cure, whether they go for treatment before complications or not, is a different story entirely. What age is mostly involved in these acts of coitus we're talking about? Studies again have shown between the ages of 15 and 49, those are the most sexually active people on earth. And then even within that category of people, the found between 15 and about 28, there is even a surge in that age group compared to the older age group. So it surges up and down. And so within the group that is studied, now this is the group that was studied. This is not everybody, because I know that even at age 50, 60, 70, 80, there are still acts of coitus going on. So by that, you can see that a lot of what I'm talking about might even be an underestimation. What is koitaki? Koitaki is the age at which a person has their first sexual intercourse, what we call the sexual debut. And it happens in both men and women. Nobody is born sexual. We develop it after puberty. Right. And the funny thing, what is the commonest age of puberty? What do you think? age of koitaki. At what age? It's been found that the age 13 has been the most commonly found age at which people start experimentation. And so koitaki around age of 13. But we found koitaki in children of 8 years old. We all know about sexual assaults. We all know about sexual abuse. We know about rape. We know about people who like little girls. They mightn't even let those girls get to puberty before they have penetrative intercourse with them. Yes, this happens. So when we say koitaki is about age 13, averagely. Although we also know about people who don't have intercourse until their marriage, and this may be at age 25, age 30. I've seen people age 30 who haven't had sexual intercourse before. So these are the outliers. What is the optimal age for sexual intercourse debut? That first one. Is there an optimal age? I'll leave you to think about that while we continue with this presentation, and then you will make up your mind later on as we go along. What is the lifetime number of sexual partners above which one should be concerned? Did you know there was something like a lifetime number? Think back. What's your lifetime number between when you started sexual debut and today? 10? 15? Yeah. Well, science says that 10 is the golden number. After having 10 partners, one is thought to have had a significant number of partners, and having more than 10 lifetime partners increases the risk of many things, including cervical cancer. Now, what if there is a person, one of a couple, who has maybe had 1, 2 partners, but is partnered with somebody who has had 20? So what will that person's exposure be? Well, your guess is as good as mine. I'll leave you to think about that. So what am I here to talk about today? Our cervix. What is our cervix? From the slide, you'll see this pictorial drawing of a healthy female uterus with its tubes, the ovaries, the V, and the cervix. So the cervix is that portion of the uterus, which is the womb in local parlance, that goes into the V. If you put a speculum, that's an instrument for looking into the V. If you look into the V with a speculum, right at the top of the V, you will see the cervix. That cervix is like what is called the entrance to the womb. That cervix comes with every girl child that is born with a uterus, more often than not. And it continues a process of development and maturation. The cervix finishes its maturation at about the age of 25. So between puberty, which is like age 10, 12, from birth, puberty, the cervix is engaged in maturation of its cells. There are changes that are going on in those cells up till the age of about 25. So what is the best age for sexual intercourse? It's beginning to look like 25 is a golden number. And then on the second picture, we're going to see that pictorial drawing of a cervix and a uterus and some blue dots on it. Now those blue dots represent human papilloma virus, HPV. What is HPV? It's a virus that lives on our skin. It's found on the skin of the P and all the organs around the external genitalia of a man. It lives on the skin. It doesn't cause any problems there. But when it goes into the V, that skin goes into the V. Some of this human papilloma virus is deposited in the V. And then what happens? Because they're viruses, they're living organisms. They swim into the cells of the cervix. They enter into the cells of the cervix. And then they begin to replicate themselves within the cells of the cervix. Now, this happens to every woman who is sexually active, whether you know it or you don't know it. And then what happens next? Remember COVID? When we had COVID a few years ago, we heard about how the COVID virus enters into a cell, begins to replicate, and how it overcomes the immune system of the person. Precisely the same thing. The human papilloma virus, it goes into the cervical cells of a woman, begins to replicate itself, and begins to fight. The immune system of the woman now begins to challenge that virus and starts trying to eliminate that virus. A certain percentage of women will eliminate the virus within maybe a year or two. Another percentage of women will not be able to eliminate the virus, but it will be latent. It will be there, but it's not very active. And then another certain percentage of women will not be able to eliminate it. Instead of it being latent, it continues to divide. And so it continues to distort the cells of the cervix. That distortion is called dysplasia, right? And this dysplasia can continue for years. It could take like 10, 15, 20 years. Eventually, so much of the cells of the cervix is altered, then it transforms into cancer. So this is how cancer of the cervix begins. It's now known as a sexually transmitted infection. HPV has been found in 99.9% of cervical cancers. Now, HPV lives on the skin, so why should it be so harmful? Well, it's been found that there are over 100 different types of HPV, but there are some, about 6 of them, that are really potent, really implicated, 2 in particular, implicated in 99.9% of cervical cancers. And who knows who has this? Of course, the men who are moving around, they don't know what they have on their skin. The women who are engaging in intercourse, they don't know what they're receiving. They don't know what they're collecting. It doesn't have symptoms, right? So how do we get to know what we have? There is a test called the pap smear. In this third picture, you'll see a sample of cells from the cervix being removed with a brush. And this is then put into some chemicals, and it is tested in the lab. So the cells that are in the cervix can be seen under the microscope. We will know whether there are changes in it and what stage those changes are at. Then we can also test for HPV and find, does this woman have HPV? Is she HPV naive? Does she have the HPV viruses that are implicated in cervical cancer? And if she has it, what do we do? Is there already dysplasia in those cells? And if there is dysplasia, how do we now treat it? What do we do? All of this is something that your doctor, your family doctor, your gynecologist can support you, right, to manage. Do I need medication? Do I not need medication? Do I need surgery? Do I not need surgery? Where am I on that spectrum? From infection with HPV to dysplasia of the cervical cells to pre-malignant lesion of the cervix to cancer of the cervix. It's a spectrum. It may take about 10, 20 years to get there, but if you don't do anything about it, then chances that it's going to come are higher than not. Let's look at the next slide, human papillomavirus. I've shown you a picture of a viron. It just looks like that. That's just a pictorial representation of what a virus may look like. How does HPV show up? Like I said, it's changes in the cervix. In this, you can see a cervical growth. There's a growth in that cervix. Could that be pre-malignant lesion of the cervix? Could it be a malignancy, an early one? Could it be an advanced one? You won't know except you get it tested. You may not have any symptoms. The commonest symptom is postcoital bleeding. Postcoital bleeding, bleeding following intercourse. But there are some women who see it and they think, oh, it's my ovulation bleed. Some women see it and they're like, what is this? Maybe I had an injury. Some women see it and they just disregard it. No, if you ever have postcoital bleeding, present in the hospital as soon as you can. You need to get somebody to examine that cervix and to take a sample and send it to the lab and find out what's going on here. Some people don't come on it until it is so huge that it's when they are walking because of the friction in the V that causes bleeding. And then they come to the clinic. And when one goes to examine, you can find some really huge cancers that you can't operate them again. They might have spread to the bladder, they have spread to the rectum. Some might even have gone through the blood to the bones. And this is what we call metastatic cancer. At that time, the only thing we can do is palliation. How do we make life more comfortable for this woman? What do we do? Radiotherapy? Do we do chemotherapy? But at that time, surgery is a bit late. Surgery may just be to remove the bulk, to reduce the bulk. It may not be curative. But if you come early, if it's detected early, it can be cured. 100% cure with surgery can work. What other ways does human papillomavirus show up? Now, for those of us who have people who have sexually transmitted infections, those infections make the cervix raw. They make the cervix inflamed. And this is a good environment for HPV to enter into the cells and continue to do its destructive work. So the presence of STIs also is a risk factor for cervical cancer. Now, cervical cancer, I've been talking about the woman's cervix since. What has it got to do with the man? I'll tell you. If a man has the dangerous HPV around his external genitalia and he has anal sex with another person, he can deposit it there and that person can develop anal cancer. If a male has it around his external genitalia and he has oral sex with another person, whether male or female, that person can develop oral cancer. Oral cancer is in the throat, right about here, through the mouth. Oral cancer, cancer of the throat, oral cancer. About 90% of them or more have HPV. How did HPV get there? We saw the HPV on the external genitalia. How did it get into the throat? Those who enjoy oral sex, whether it's oral, vaginal, or oral P, oral sex, once that fluid, if the cervix has HPV in it, the dangerous ones, the cervical fluid that comes during intercourse is loaded with HPV. If somebody's mouth is there, they have a good dose of HPV and it goes into the cells of the throat, which are rapidly dividing cells, and it implants itself there and it starts to grow. If it's the other way around and it's a P in the mouth and the person is there, just the fact that the P entered the mouth without anything on it, the skin flora goes in, oral cancer. These are amazing things and these are preventable things. So we can see the slide that shows oral cancer on the tongue. It could be anywhere, but usually it's back in the throat, just like in this second picture that showed oral cancer. How can we prevent this? Why is it a burden? It's been found there are some countries that do pap smear, routine pap smear. Sometimes they say 3 years after a woman starts having sexual intercourse, do your first pap smear. And if it is okay, then there's a schedule every 3 years, every 5 years, or every how long, depending on what is found. But there are many countries that don't have this routine screening. And then there are some countries that have the routine screening, but the women still don't go. Ladies, we still don't go. I will share a secret with you. Where I came from, it's not routine. I had my first pap smear at age 44 when I was in the clinic. And I saw women at age 45, 47 with huge cervical cancers. And I had to talk to them. I said, Madam, what happened? You just come in now. And they said, well, you know, they saw it and they thought it was their period that was just being abnormal. And I said, didn't you have postcoital bleeding? They said, oh, they've had all their children. In their culture, intercourse is only for women who want to have children. So they haven't had intercourse in like 10 years. So they didn't even know there was something growing. And I'm like, wow. So without a routine pap smear schedule, without routine checks, without regular sexual intercourse, these women didn't know, and with a lot of ignorance in the background. Now, this was terrible because I looked at this and I'm like, whew, this has gone beyond what surgery can treat. We're going to do some radio, some chemo, but it's all palliative. And I looked at them, women in the prime of their lives, 45, 47, coming down with cervical cancer, which will most probably kill them, which was something that could have been avoided. It is painful. And that is really what pushed me along this path of ringing the alarm, sounding the alarm. Now, do you know, ladies, there's something called HPV vaccine. Yes, I know. A lot of us hate vaccine. After COVID, a lot of us are very mistrustful of vaccine. After autism and all, a lot of us are very mistrustful of vaccine. I get it. I hear you. But when we compare the cervical cancer versus the vaccine and all the fads and all the myth, well, I think we may sway in the way of safety. And so what is prevention? There is a vaccine. In fact, there are 2 or 3 now that are given to young girls aged 8 to 10 before they ever start sexual intercourse. These vaccines prop up their immune system so that when they start sexual intercourse and they come in contact with HPV, they'll be able to mount up a stronger immune response to get rid of that HPV. So HPV will not become incorporated into the cells of their cervix to cause cancer later on in life. These vaccines are given to children. It can also be given to adults under the age of 25. Like I told you, the cervix continues to mature up to about age of 25. So even women who have been exposed to intercourse can still get the vaccine, especially after they've done a pap test and we do not find the the dangerous HPV strains in their cervix. They can be protected with the vaccine. Ladies, we need to do something. Did you know that being mutually exclusive, when you're in a long-term relationship and it's mutually exclusive, one man, one woman, one partner, and just us, it also reduces the risk of both of them having cancers from HPV, because whatever they have between them is what there is. So they can get tested. The woman, so when we know that between this couple, there is no dangerous HPV, if we keep to ourselves, then we remain safe. What about those who are not yet married? Well, there's something called abstinence. I know, we all hate abstinence. Everybody, especially the younger generation, they hate abstinence. But then, if we're talking about safety, if we're talking about life, what are the pros and the cons? Abstinence versus this, you know, because if I don't abstain and I have a partner today, and next year I have another partner, and I do this from age 13 to maybe 25, 30, chances are that by the time that person is getting married, they've had more than 10 lifetime partners. So this is called risky behavior. We call this risky behavior because, you know, the risk outweigh the benefits. Early detection is the next step. That's level 2 prevention. Okay, so we didn't know, right? We're women. We didn't know. Well, what do we do now? We go for pap test. We go for pap test with HPV screening. And then they look, is there HPV there? What are the things that have happened in it? Is there a pre-malignant lesion there? Should we go for surgery? Should we remove it? Is there early cancer there? How have I reacted and responded with HPV? You know, knowledge is power. I know a lot of women are actually afraid to be told many things because they think that if I go and check, then the doctors, they always find something and then they always want to operate, and they have a huge mistrust for the medical system. But then the cost of not going is more expensive, is heavier than the cost of going. Abnormal vaginal bleeding, like I said, is a very, very great, you know, signal. It's like a lamppost. When you see abnormal bleeding, PV, please go to the clinic as soon as possible. Don't delay. Don't delay. Delay can cost you your life. Don't delay. It's very painful to see women 45, 50 dying from a preventable cancer that they could have prevented. At the time when a woman should sit back and see her children grow, when her children are probably out of university, they are working, when she should sit back and rest. It's so painful for a woman to die at that time from something she could have prevented. That's why I'm asking all women, check yourselves. Go for your pap screen. Go, if it's not routine in your country, go and meet your doctor. Say, I heard Dr. Show talk about pap tests. I'd like to do one. I heard Dr. Show mention something about the cervix. Doctor, check me. What is my cervix saying? What is my cervix saying that I'm not hearing? What is my cervix saying? And so now also I have recognized something. Because of my time in the clinic, I also find that there's something about us women. Sometimes we see that abnormal bleeding and then we go into denial. No, it can't be anything sinister. No, it must be something that happened. No, it must be this. The fear. There is that fear. So there's something I also do. It's called coaching. It's called coaching. So I have ladies who have met me and reached out to me and Dr. Show, I saw something, God, I'm afraid, what do I do? I coach them, I handhold them through the medical system, irrespective of the country that you are in, to get help, to get support. I offer support. You know, that's what coaching does. I offer support to such women. Let's go and look. Don't be afraid. Whatever it is, don't be afraid. I'm here for you. That's the coaching arm of this business. And then what about the counseling? Now, there are some women who have, yes, they've been to the doctor. Yes, the doctor found something unusual, something we really don't want to see. What do I do next? There's first the emotional overlay. There's first the fear. There's first the sadness. There's first all of those things. Counseling. 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 Get counseling. Get somebody to support you psychologically, emotionally. But whatever you do, get medical care. Go and see your gynecologist. If it is something that needs to be operated upon, please go for it now. Delay can be fatal. Delay can be fatal. Ladies, let's do something. That's our cervix and our sexuality for today. We'll talk more about it. I want to hear your questions. I want your comments. I want anybody who needs me. Just reach out. Reach out. Thank you.